Hello and welcome back to another episode of the Orem Meridian, an Orem Group podcast. I'm your guide to dental excellence, Robert Hawkins. Today, my guest, he's a friend. We've known each other for about a year and a half now. He's got a really cool solution for you, whether you have any kind of online presence with your dental practice, whether you have a website that was built 30 years ago by Yellow Pages and you need to update it to something, WordPress, Squarespace, whatever it may be. He's got a really cool solution. So whatever your digital footprint is, this episode is relevant to you. And it's going to make new patients specifically easier to find you. My guest, Andrew Rindler, COO of Intelibly. Andrew, welcome. Great to see you again.
Thanks, Robert. Great to be here. Yeah, it's a great point. It's if you are interested in new patients and growing your practice, this should be relevant to you. Yeah, exactly.
Nah, no, we're not interested in new patients or anything like that. We're full up. Thanks. Thanks very much. So I don't think I've ever heard someone say that. I don't think I've ever heard someone say, "No, I'm good. I'm good, thanks." Even if you put them on a wait list, why wouldn't you want new people in your practice, right? So, um, glad to have you on. Tell me a little bit about you. How did you go from, because you were kind of born into a periodontist's office, and we'll get into that later. But tell me, how did you get from let's just say graduation to where you are now?
Yeah, no, absolutely. So, like you mentioned, yeah, I was born in the dental world, I would say. My dad is a periodontist. He's also the founder of Intelibly. And I grew up around dentistry, understanding it, and I joke that I ran as far away from it as possible. Kind of joking, but after school I went into consulting in the digital strategy space, and it just so happened that my first project out of school, I got a call from one of the partners that was at EY, and he said, "Hey, what do you know about automation? What do you know about robots?" And I kind of laughed and I joke now that I talk to people and I say, my mind immediately started going towards, big robots taking over the world, iRobot, whatever it may be. And I quickly learned that really robotics and process automation and things of that sort about a decade ago was a lot of computer coding. And so as that moved on, in time, I was at EY for a long time, and then I went over to Deloitte. And a few years into Deloitte, I was a strategy manager in our AI strategy group. And my dad had started to build this company Intelligibly. And so my customers were Fortune 100 companies that had hundreds of $1 million to invest in technology, ultimately looking for $1 billion of return. And as I started to learn about Intelligibly and what he was building there and kind of the digital dentistry and the workflow around that and how technology was moving, I saw a lot of the same potentials in the space and what we were building. And so when it comes to Intelligibly, what we do is we remove the friction in patients connecting to a practice through their trusted sources. And what's really nice is as I started to learn more about the dental world, I realized that for dentists, a lot of the times is a lot of the technology that's being built isn't built through the eye of the clinician. And so what I think is so different about Intelligibly is that we were built through the eye of a clinician. My dad is a private practice periodontist of over 25 years. And as he built Intelligibly, he really looked at it as how can you benefit the provider? And so obviously it has to be great for the patient. It has to be a smooth experience, but it also needs to be good for the office because, and I'm sure we'll get into this a little bit more, if you adopt technology, ultimately it has to be great for the end user. And so that's kind of where we built Intelligibly out of.
I like that a lot. Um, I really want to dive into that more because you said something very specifically there. It's got to be great for the office, but it's ultimately got to be great for the end user, which is the patient at the end of the day, right? There's like, I don't know how many call agents there are. I should have Googled this with Gemini or Claude. How many call agents there are now for dental practices? And don't get me wrong, there's one for everyone out there, and it's a great service. But if it goes down or you don't set up the back end data wrong as a patient, frustrating as heck. I can tell you here in Canada with Rogers, they set up a chat agent. You go, when is my next bill due in the chat agent? I'm sorry, I can't help with that. That's got to be like the most common question. So if you don't build that chat agent or that call agent properly, that's frustrating, right? In today's world of instant gratification, thanks to Amazon, you can buy anything, you can book anything online and receive it immediately or receive a confirmation immediately. I have to give a shout out because I just checked the people watching live with us. Dr. Eric Rindler is here. Eric, hello. Thank you for watching with us tonight. Great product. You're welcome to contribute to the chat as well too, but Andrew's got it from here as well too. But feel free to chime in on the chat if you can as well too. So as we jump into that, we talked about making sure that the patient experience is great. What do you see right now is the greatest friction point between a new patient and gauging their interest and actually getting them to book an appointment? What is that pain point right now?
Yeah, that's a great question. So I'll go back to something you were saying a second ago around all the different chatbots and the voice agents and everything. And I think a term that we'll probably use a lot tonight and that I love to talk about is digital first. And patients today are digital first. That is our expectation as consumers. You mentioned the Amazon instant gratification. That's an example I love to use. But in everything that we do as consumers, whether it's a restaurant reservation or an airline reservation, hotel reservation, really everything that we do outside of healthcare, we book online. And so I'd say, the patient communication tools, the call agents, I think every practice should be utilizing them. I think they're an unbelievable tool. When a few years ago we were talking to people and what they would say is, once a patient connects with our practice, it's awesome, but we probably miss 80 to 90% of the patients trying to reach us because ultimately what we're doing is we're working with the patients in front of us. If we're discussing treatment or checking them out or discussing financing or whatever that may be, that always takes precedent over answering the phone. So I will say those technologies are awesome. And I think utilizing them is a huge piece for the practice. But where I see the greatest friction between patients is patients, tens of millions of patients every month are going to industry finder tools, whether it's your insurance site, a dental plan, a specific product like aligners. They're going online looking for information about dentistry. And there's a disconnect about where the patients are looking and where the actual appointments are. And so on the other end, you have providers who are spending money on marketing, they're spending money on online scheduling tools, they're spending money on these agents that you're talking about. But the gap of where the consumer is actually looking for that appointment in a digital way and the ability to connect with the practice is a huge disconnect. And ultimately, that's where Intelligibly fits in. And so what we do is we integrate into industry finder tools and we connect patients with one click without being redirected away from their trusted source to that office. And so we know patients are digital first. Let's give them the ability to instantly connect with the right provider in a high intent fashion of where they're currently looking. So I'd say for me that's where I see the a huge gap in actually patient interest in booking that appointment.
So let's tell me more about that because there's a few very technical things that a lot of people might be like, so are you saying I need to redo my whole website or and the user experience, and there's a couple terms here that you've sort of alluded to, but some people may not be familiar with. One of them is a bounce rate. So what is the percentage and the amount of time when a patient comes to your website, how many pages are they visiting and how long are they staying on your website before they go? Okay. If your website is too difficult to book or it's not navigation friendly, they're gone, right?
Yeah,
People's attention
absolutely.
span, thanks to social media, is so limited. I think, ADD, ADHD might be the most severely underdiagnosed thing thanks to those two things now. But um,
Right.
tell me more about how, how Intellibly sort of addresses that challenge of the bounce rate and keeping people, you said, not letting them go from that trusted source where they've landed, which is your website or the insurance provider's website.
Right. Yeah, so I'll answer that in a couple ways. So I'd say the first way is that if they end up on your website, so as the practice website, you want to make sure that ultimately the reason that a patient goes to that website is to find how to schedule in your practice. And so you want to make it as easy as possible. And so at Intelligibly, we have the ability for you to add a button to your website. It's one line of code, so it's very low effort, but essentially the least amount of clicks and the least amount of fields that a patient has to fill out, the better. We see that for every extra click, you lose about half of the patients, so about 50% drop rate on that. And then for every extra field that you add, you lose another 20% of patients. And so making it extremely simple for a patient anywhere on your site to click to book is great. And so, traditionally you have a lot of request features, and then now we're starting to see integrations coming in and being able to actually book new patient appointments on those websites. So that's a piece that I'd say is instrumental for everybody. But to your point around, even where they're looking is so if you're on a site looking for information about dentistry, the patient shouldn't even have to get to your website to be able to find you. And so that's kind of the goal is there's all these industry finder tools. And so being able to actually put your appointments in front of them at that site is a complete game changer and
Yeah.
should, just reduces friction in patients actually getting to see you. Yeah.
Yeah, absolutely. So I want to dive one more level deep into that,
Yeah.
and that's you made a great point as a patient. It's a very patient centric solution which you got. And why I like it is you don't ask for 32 pieces of information on your form. It's, the basic information. It is, I assume it's name, phone number, and email probably, right? Is probably something
Date
very
of birth,
date of
info.
birth. Yeah.
Yeah.
Okay.
Yeah.
So I guess the question that I have for you then is the next step for follow-up is if they're booking an appointment directly in there, can you set up different appointment types like new patient consultation, or they know they need hygiene, or if it's an urgent appointment, maybe
Right.
call the practice, or go
Yeah.
to the hospital or whatever. But how does that? Because I can see a lot of people going, well, I don't want to open up my schedule willy-nilly just to anyone. I want to make sure that it's qualified, that they're filtered. So tell me a little bit about that as well too.
Yeah, Robert, you nailed it. That's exactly it is. I think the traditional mindset on online scheduling is, well, I don't want to open my calendar to let people book surgeries. I don't want them to open for things that aren't new patient appointments. And so we typically recommend starting with new patient appointment or hygiene or whatever that may be. But ultimately, the reason that we only ask for a certain number of fields is because kind of what I was discussing earlier with the change management is we want to reduce change management of a practice. The last time you and I were together, I made a joke where I said, if you talk to 100 practices about their new patient intake, you're going to have 100 different processes. And so if you dictate how that has to be done for a practice, the probability of the front office, the office manager, everybody leaning in and accepting this new method is very low. And so the least amount of change management, the least amount of change for a practice, the least amount of education that has to happen, the more likely it is to be consumed. And so we ask for, a minimal number of fields, how that's ingested into your practice. It can be directly into the practice management software. It can be through an email. It can be through a patient communication tool. And really, we let them customize how they receive that. And so we want to make sure that as simple as it is for the patient to find and connect with you, it's just as simple for the office to ingest that information and follow their current processes. So we really stay in our lane with that, which, yeah.
Ooh, I like that. You stay in your lane, but you're patient centric. That benefits makes it easy for the practice. So tell me, you mentioned one thing, which is I think every single practice out there, unless you've got it dialed and you don't have any turnover, you mentioned that one of the biggest pain points for practices is change management. You get someone who goes to a trade show, a show or whatever. Oh, I saw this great new thing. It's Intelligibly, or this new piece of equipment, or whatever. Come
Yeah.
back, they go to the office. Boom, I bought it all. It's coming in tomorrow. Let's do it. And you're like, well, hold on, I haven't been trained. I've never heard of this before. That's changed. That's so how do you manage that is one, but I think, you know, sticking with this sort of software AI piece is,
Mhm.
of all the initiatives that are coming out, what would you say, are the AI initiatives that are delivering really the most measurable growth? Because you've got these call agents, you've got all kinds of, we were talking about AI software to help with video editing, things like that. But really, what are the ones that are giving, in your experience, the most room or showing the most growth for practices?
Yeah, that's another great question. I think my thought on that is I think you have to look at the patient life cycle as a whole. And so to me, you have to look at before the patient gets to the office. And so how are you handling that process? You have to look at about when the patient's actually in the office, how can you leverage technology for that? And then on their way out. And so from the patient side, that's really what I think about. So from before the patient arrives, how can you automate the intake process? And so by having an online scheduling tool and putting the appointments for new patient appointments out there, that's great. How can you automate new patient forms? And how can you make that process simpler for the patients and less time for your front desk? I often talk about the negotiation of the next available time
Hmm.
for an appointment. So a lot of times, a lot of online scheduling tools and marketing firms, when they talk about that, they say it can be up to 15 minutes of negotiation with a new patient to discuss when they should first come to the office. And so if you can cut that down significantly for an office, you're getting tons of time back that can be spent doing other activities. It can be spent working with the patients in the office. It can be spent, a backlog of activities, but not having to have that conversation. So I'd say figuring out ways to automate the beginning of the process. So before the patient comes, once the patient's in the practice, what are different tools that you can use to increase, treatment acceptance? And so there's a ton of tools around AI scanning and imaging. And I think I saw a stat recently that said case acceptance when a patient can see a comprehensive exam is up 25%. I mean, that's unbelievable to me because there's just you can see that information and you can communicate it, and it's simpler in that notion there. I think in the office, understanding financing opportunities for patients. Also something you can do before they get there, but if they're in the office, being able to have that discussion and so they're able to know, okay, I'm about to have this treatment discussion, but I also know I can afford the treatment. I can afford, if you recommend, hey, you need 4 implants, I'm not thinking, okay, well, I can afford one. I'm thinking, okay, I can actually afford the total, comprehensive care and that side. And so then that's when they're in the office. And then on the backside, revenue cycle management, claims automation, there's so much technology out there that I think it's really important to look at that. But I think on that, we also are starting to hear about these solutions where they say we do everything. We're a comprehensive AI solution. Um, I think that's great in theory, but I think when you think about the winners who will deliver the most measurable improvement and like the best way to partner with offices and things like that is looking for really great point solutions that have the ability to integrate into the existing processes. And so once again, we go back to that change management of if I say, hey, I'm implementing this new technology, it's going to replace our entire system. There's a ton of change that has to go with that. And you have to get everybody's buy-in on that. And ultimately, is that going to be the best solution for your patients? Is it going to be the best solution for your assistants, whatever that may be? And so I think finding really great solutions that can deliver value and then finding ways to integrate those into your existing processes is really good. And it's actually funny, Robert. I think as I continue to learn more about these things, um, I'm even seeing other things. Like we have a mutual friend, Sri Koka, who I was chatting with recently, and he mentioned they've created an AI training for dental assistants because there's a huge
Yeah.
issue and a shortage of assistants. And so what he said is, it's great an office can automate the training and then they have everything they need. And so it's not even just about the patient anymore. It's about the entire patient life cycle, but also just the life cycle of the office. And so I get excited when I see all the new technology that's coming out.
I really like that. Definitely a shout out to Dr. Koka. I saw him and I saw you and your dad as well too back at Seattle Study Club Symposium earlier this year. So yeah, I just saw that Dr. Koka's new software launched today. So check that out as well too if you haven't. And he's got a cool TED Talk. We're gonna get you on a TED Talk next, Andrew, up there on the stage with Sri. So you kind of touched on this a little bit, but I just want to kind of get back to it. Strongest opportunities for collaboration between dental organizations and tech providers. Like there's so much noise and so many different places you can go. You've got perio charting, you've got software that's reading your x-rays, your radiographs, you've got AI front call agents. What is the strongest, what would you say is right now something that's not fluffy and in development? What is something are you finding is tangible that people can implement tomorrow and have success with it?
Yeah, no, that's a good question. I think it'd be amiss if I didn't plug Intelligibly on this. I
Of
think it's
course,
something
yeah.
that I think it's something that every practice can leverage and can be a huge benefit to the entire industry. It's something where it's no cost for providers to receive appointment requests from their partners that they already work with. Integrating their calendars, the payback period is less than one patient for the most part. And that's something intentional we've done because we want to create that ease of access and connectivity. I think, there's certain things and certain technologies across the whole life cycle that make a lot of sense. Kind of what we're talking about, like that whole, before patients get to the office, in the office, and post. But ultimately, I'd say where there will be the most success and partnership with an organization is a technology that that organization is willing to spend the time to implement. And so I think a low lift is important, but getting buy-in from staff, getting buy-in from the team, getting buy-in from everybody who's using it is the most important piece. And so, even when I was doing my consulting in those days, if we'd bring a really awesome technology, but there wasn't buy-in from the company, it was a failure every
Hmm.
time. So getting that buy-in, and I'm smiling because I'm thinking about whenever I'm at a trade show, and you see this all the time too, is when you walk around, there will be, call it 500 vendors there, and they all have a new technology. They all have something that can benefit the practice. And what they tell you is you see two patients a year or two patients a month, whatever it may be, it pays for itself. But as you start to have, 200, 300 pieces of technology, you can't buy all of them. And so, um, often when I talk to practices, I tell them the first thing is you have to figure out what your goal is as an organization. And so, is your goal to grow? Is it to sell? Is it to bring on a new associate? Is it to, do more treatment, whatever it may be, and then find technologies that fit in there. So I think making it easier for a patient to schedule in your practice. And so those high intent patients is a big thing. And so that's where I talk about Intelligently is we know our patients that come in. Often I hear about no-show rates and people say, oh, I have a lot of Google patients. They come from, ads or whatever it may be, but they sometimes no-show. With Intelligently, we see our no-show rate very, very, very low. But that's because they're high intent patients. They're trying to use their dental plans. They're trying to use their insurance. They want to get an aligner from a company that we live on their finder tool. And so they tend to be high intent patients that show up. And so that's a really good thing. When you're in the office, the imaging is great. I talk to providers who say, the first thing I do is I scan every patient who comes in so I can give them an overview of their mouth and they can see what's going on from the beginning. It creates trust. They tend to move forward with treatment. That's great. I think um, the integrations with new financing tools, I think the ability to show patients that they can afford treatment ahead of the time before they get to the practice, it makes that easier for the patient. It makes the conversation for the team at the office much easier. I mean, I think there was a study put out by Care Credit that talked about where it's 88% of patients are interested in financing opportunities. But at the same time, it's over 80% of front office teams don't like having those conversations with patients. And so there's the ability to leverage technology for that changes the entire conversation. And then on the back end, we're seeing a lot of advancement with RCM tools in claims processing. I think I saw something recently that said with AI claims tools, reduces the time by 60%. And that's just so much time back for the team. So, but I
Hmm.
think ultimately it's finding what works best for you and what your team can really work with, but also creating a connected process between all of them, not just, you don't want 12 logins. You want to find solutions that integrate into your existing systems in that nature. So that's a long,
I,
long answer for
I don't even remember what the question was. No, I'm just kidding. Yeah, it really is important. And I think that question about money still makes a lot of people, both in practice and the patient side, uncomfortable, right? Because you're like, oh, I don't know if I have the coverage. I don't know how much I can afford. I know I'm probably going to need a couple of different crowns or whatever it may be. I don't really want to tell, and a lot of people don't like confrontation, right? So
Yep.
they'll hear the spiel, they'll hear the pitch from their provider, and then, they'll go, okay, I'll think about it. Great. And go home. And then, of course, they either ghost or they say, I'm only going to do one or whatever, because they don't want to have that conversation face to face. And that's frustrating for everyone. But if they're able to pre-qualify using Intelligibly or through their insurance provider and connect with the right provider, that awkwardness is removed because going into it, both parties know, right? So
Yep.
then their practice can have their script and say, all right, I know Andrew's coming in. He's got lots of moolah. He's got great coverage. We're selling him everything. Okay. Or
Yep.
you could say Robert's coming in, he's Canadian. The exchange rate is terrible, so we're only going to do a cleaning today. Okay, we're not going to push him. We're going to suggest other alternatives. So I think that tool of pre-qualification and finding providers who accept your insurance is so powerful as well too. And
Yeah.
also having that reducing that time, like you said, in today's world, 15 minutes on a phone call just to book an appointment is insanity, to be quite honest. Like to be able to book it right then and there is the only way to go these days for sure. And I want to make one distinction, if we didn't already as well too, is a lot of people say, well, yeah, I have a booking thing on my website. And you go and you fill out the form and you go request an appointment. No, no, that's different. You're still requesting. That still means someone from your team needs to call you back or needs to call the patient back and say, well, Mr. Jones, we don't have the time you wanted, but what about 7 weeks from now? It doesn't work. They could have just either found someone else because they need it urgently, or chosen a different provider in your practice, whatever it may be. So
Yep.
I think that's a big distinction and a big problem that Intellibly um, solves, to be quite honest with you.
Thanks. Yeah, no, Robert, I agree completely. I was having a conversation with a company recently, and they were talking about the integration capabilities, and so we were talking about something similar. So, like you mentioned, a lot of practices now have online scheduling on their website. So they have the request, they may even have online scheduling. But what happens is the patient still has to go from where they're looking for that appointment to the website, and then hope there's an appointment available. So it's click, click, click. Often they have to create accounts. I know personally, if I have to create a new account, I'm probably not going to do it, to be honest with you, as a consumer. Um,
Yeah.
but what we find is when I was talking to this company, they said it's really interesting is the biggest barrier we find is that sure, someone may request an appointment, but ultimately, if you request an appointment and you don't hear back immediately, so let's say it's a Thursday afternoon, office is closed Friday, you're probably going to request another one and another one. And ultimately, you're going to go to that first one that calls you back. If a practice has the ability to show those appointments at the source of where I'm first looking, I'm taking that first appointment and we're good. I'm in the practice. It's immediate revenue for the practice. I'm a new patient there. If they do everything right, I'm there for a while. I do a lot of treatment, and so we're seeing a lot of uplift on that as well. So it's been really interesting to see the numbers behind it.
People's time and attention spans these days are so finite and limited because everyone's trying to hustle. Everyone's, out there on the grind trying to get by. They got, priorities outside of work life. So when they're going to book an appointment, you got to get them when they're dedicating that 2, 3 minutes. I literally booked something, no joke, waiting in line at the grocery store the other day.
Yep.
And it was like, okay, this, the cashier was taking a long time. Like, okay, and the kids are running around. So I said, okay, I'm just going to book this really quick. Boom, done. Thankfully, what I was looking for worked, it booked. But if I went to that one site and they couldn't book it, I would have dropped it because then I would have had to keep going. I would have had to, go pay for the groceries and figure out where my
100%.
kids are, right? So it's so, excuse me, it's so, ah, end of a head cold here, everyone. Sorry, apologies for the cough. It's so important to be able to just have it book right there, that bounce rate. Even if you're not considering a patient booking on your website, that bounce rate is an incredibly important statistic.
Yeah, it absolutely is. And I think everybody or most people can tell a story, whether it's in dental or on the medical side of having to look for a new appointment. I know I tell a story about how when I moved from Texas to Tennessee years ago, I was looking for a new, just in general, a primary care physician just to make sure I had someone to go see in the event I needed a routine checkup, whatever that was. And for 7 months, I tried, I've leveraged relationships. I went online looking for appointments. And then I ended up tearing my meniscus and going in for a knee surgery. And while I was there, I happened to ask the doctor. I said, "Hey, by chance, do you know any PCPs who might be able to see me?" And he said, "Oh yeah, my best friend is one down the hall." He sent a text. I was able to go see the doctor right there. But the reason I bring that up is because it's something so many people deal with. I believe a stat I was told the other day was 18% of people get routine dental care and they go for, so the number of people who either don't have access to care or get frustrated in the process of finding care. I mean, we're talking 80% of people don't go see the dentist. And I mean, it's staggering to me, and the potential there of when we talk about it from the business side of is unbelievable. When you talk about it just from the overall care and health, and as we get into the medical dental integration and everything around that, I mean, it's so many things can be identified by going and just getting that routine care, but we make it so hard and we make it so impossible often for patients to actually go see providers. It's there's a ton of marketing that gets done. There's a ton of things, uh, to get your practice out there. But if you don't let patients schedule with you and you put up that wall, it's kind of what's the point of that? And so, but yeah, I think it's something that everybody's dealt with. And so, by lowering the friction, we're hoping to really just increase the amount of care that people are getting.
And it's a great point. It's something that I've been talking about on previous sessions here as well too. Is uh, you spun it to the negative that only 18% are getting, it, but there's the flip side of them who are. And on average, they're seeing their dentist, or in a lot of cases, their orthodontist or their hygienist 2 to 3 times more per year than their PCP or their GP,
Yep.
right? So why not bridge that gap and do this medical dental integration, which we've been talking about? It's so critically important. So with
Whatever. I
that
love
being,
I love the I love you spinning it in a positive way. It's very Canadian of you to do that.
I try.
Yeah,
We'll leave the
absolutely.
politics out of that. We'll have the political conversation offline, all right? Um, Wanted to ask you, so there's so many, again, going back to there's so many digital tools and a lot of practices are getting on board. There's a few, I've been in a few, not recently, but a few years ago, walked in and I thought when I walked through the dark cherry red door, I walked into a practice that was built in 1992 and hasn't been touched since.
Yep.
Um, but mostly these days, practices are going digital. So truly, how are they creating like a competitive advantage and driving growth when a lot of their competitors, a lot of their colleagues down the hallway, in my hometown, Vancouver, in BC, there are a couple buildings downtown Vancouver where there are more than 300 dentists in one building. And there's all different. There's surgeons, there's GPs. So
Yep.
how do you stand out if you're all going digital, how do you stand out? How do you gain a competitive advantage in that field?
Yeah, it's a great question. I think my first instinct on that is I think there's digital point solutions and digital features. And so we talk about, adding integrated scheduling to your website. Like that's a great way to do it. But I think the practices who are really pulling ahead and differentiating themselves are making digital first an operating principle, not just a feature of their practice. And so their goal is to be a digital first, really patient experience practice. They bring it into everything they do. So I mentioned earlier the practice who scans everybody when they first get into the practice. They've made a decision that their goal and their strategic differentiator is going to be their digital first. And so that's what they do. They do their booking online, they do their new patient forms ahead of time. When you come in, you get scanned, they walk you through everything, they do a risk profile on you. And then if you leave and you don't do treatment, they even have AI follow-ups saying, hey, like here's our recommendation, here's what's still out there. We'll follow up in 3 months, 6 months, whatever that may be. And so making that I think is a big piece there. And so, a lot of times offices say they're digital first, but then you're having an analog experience with the practice. And so I think by really embodying that as a principle of the practice, you see a lot of change there. A stat I saw was that a year ago, 6% of patients used AI tools to look for appointments. It was, 6% were going on ChatGPT or Claude saying, I'm looking for a dentist near me. It is now nearing 50% of patients have done that. And so the landscape is completely changing. And so around marketing, around bringing a new patient, there's been so much SEO and things of that nature. And I'm even seeing it with Intelligibly in our analytics. We track, where the patient, the appointments are coming from. And we're starting to see ChatGPT, Claude. And what we find is that the practices that are showing up are the ones who have enabled digital tools. And so they're the ones who have the integrations on their online scheduling. They have digital marketing. They have, whatever it may be, but they're really embodying that digital first piece. And so I think that's a big thing. I still think ratings and reviews works its way into that as well. I think that's a big piece. And then I think ultimately it always boils down to the finances of it. And so by being able to understand and early, and so I'd say practices to enable, a digital financing experience and making patients aware of that. I think that's a pretty big one as well.
What would you say is what I found interesting when I moved from Vancouver to Calgary here? Most people in Vancouver, let's just say easy one, you're looking for, go out for dinner for a restaurant or, um, let's just keep on that one. A lot of people in Vancouver use TripAdvisor, Yelp, OpenTable, whatever. And then when I moved here to Calgary, new city, haven't really spent much time here. Everyone in Calgary uses Google, and a lot less people use TripAdvisor Yelp. So I found that really interesting. I was like, whoa, I've never really like, and that, mind you, that was 6 years ago. So now, of course, Google way more prominent. Where are you finding is sort of the most reliable, consistent rating sites for dental providers? Is it on the industry sites? Is it the dental provider websites? Is it the insurance website? Is it Google, RateMD?
Yeah.
What would you say is the most well used?
It's a good question. I think it depends. I think ultimately you want to find the most accurate information around a provider. And so I think ratings are important. I think they're also like with any restaurant, one bad experience shouldn't, people would tend to write more negative reviews than they do positive reviews. I think that's always something. I think when you look at your insurance, so one thing that was kind of a myth to me that I feel like has been busted was that when we talk to providers, they say, no one, my patients come to me because of who I am. And that's true. They do. They were recommended to you by a neighbor or by their general dentist or whatever it may be. But ultimately, if they have dental insurance or they use a dental plan, they're going to make sure that you take that plan. And so by having accurate information, and I think having accurate directories is hugely important. We're also starting to see there's, starting to be laws around that. And there's, the government's now getting involved in saying, hey, if, those directories need to be accurate. They need to have the most up-to-date information. So I think that's a big place on the insurance. I know if you're looking for an aligner and you see a brand that you trust and you go to their provider directory, you're going to get that product. It's easy to say, hey, we do whatever the treatment may be on someone's website, but from the source of the truth of that brand is always big. So I
Mhm.
always say, go to the source, do your research, but then as a provider, making yourself accessible from where people are doing that research and that connectivity there is how I find you get those high intent patients.
One of the things we were talking about internally in a meeting just this morning actually was we were talking about leveraging and using AI as a source of information, but make sure that you've got your guardrails up and you don't take everything at face value because AI is essentially another search tool. So whether you're using Gemini, Claude, whatever it may be, you got to check the data. First of all, you've got to look at the source, especially if you're looking up controversial things or things to do with your health and your oral health. One of the things like we should, talk about as well too is a lot of, as you said, when you said 50% of people are now their primary search engine is Chat GPT or, Claude or whatever it may be. I thought you were going to say it was higher than that. I thought you were going to say it was like 96%. Because I know I very rarely use just Google anymore. It's
Right.
Gemini or it's Claude, right? Um, Tell me about the importance of having sort of that booking tool speak to those new types of search engines and how
Yeah,
critical
I
is that?
think yeah, I think it's kind of, it's funny. I think right now it's still kind of the wild, wild west of what that looks like. I think people are still trying to figure out what, the optimization looks like for algorithms. From what we see and from what I hear from other industry partners and vendors that I talk to is the more information that you offer up, the more likely it is that you'll appear. And so, if I'm looking for a dentist in my area who does a certain procedure, like I may, it may give me someone, but if I say I'm looking for an appointment on Tuesday, if it's available, I know it's going to pull someone who has, an integration out there. And so the more places it can be done is important. And I think where we're seeing right now a lot of change as well is, there is like you mentioned, inaccurate information out there. I think what we'll soon see is the ability to have more deterministic models within sites. So within your insurance site or within a trusted source or within whatever that may be, a marketing tool or a specific for healthcare or something around there, because you want to have that accurate information. So you want to make sure, hey, if I am looking on Claude and I want to find this, use this insurance plan and I'm looking for this procedure that uses this dental implant, because now people do research to that level.
Hmm.
You want to make sure that that information is accurate. And so to make sure you can trust that, I guess, Robert, to ask you a question, where are you seeing, when you talk to other people in the industry, like where are you seeing a lot of the AI trends moving, especially on, finding care?
Well, I wasn't prepared for questions back to me. I would say definitely it's regional differences, but I mean, overall, Google is still the king. Of course, you'd be surprised. I mean, as I'm sure you well know, Andrew, YouTube is the number two search engine in the world. So I think a lot of people either are going to an AI agent first, to Claude or ChatGPT, typing in their basic questions, and they'll be like, I don't know what a subperiosteal implant is or why I need it. I'm going to go to YouTube and see what kind of gory images I can find there and have somebody explain it to me there. And then maybe I will go to Cal or Intelibly or whatever and find a provider who can do that for me. So, excuse me. To me, that's where I see the biggest trend is people, you're absolutely right. You know, our CEO, Mark Meyer, he's got a great saying that says we're the the dynamic between patient and doctor is really flipping now. It's not so much anymore uh, doctor the patient will see, or sorry, it's not patient the doctor will see you now. It's doctor the patient will see you now. So it's really flipped where they've come prepared with questions, armed with Claude in their back pocket or whatever it may be. So I would say it's in terms of finding providers, networks, definitely it's still online. It's definitely not the newspaper anymore. Uh,
Yeah,
s- Not knocking the newspaper. Sometimes it's nice to, read a newspaper, whatever.
yeah,
But I would say definitely online. For me, I'll give you a personal perspective.
yeah.
Before I joined in the dental world, I had no idea. I just assumed most dentists were like expert upon expert upon expert. And obviously they sorry. Obviously they've all got excellent training, excellent education, things like that. But that varies so much. And so for me, I started looking as a patient, knowing kind of what resonated with me, really looking more into a dentist's credentials to say, where did they go to school? What is that post-secondary didactic institute? Why did they go there? Why did they spend $100,000 in 10 years to go there? And why does that matter to me as a patient? So I think what I'm seeing is more patients are doing that now that aren't in dental. They're really looking more for more information as opposed to Dr. Rindler loves to spend time with his dogs and his son, and he likes to play golf outside as well too. That's great. I like that, but I kind of want to know, like, you're gonna cut my mouth open and potentially I want to know, where did you learn to cut my mouth open? Who taught you? Why? How many times have you done it?
Robert, I think that's a great point. It's funny. It reminds me of a conversation we had when I was in Calgary earlier this summer, and I got a tour of the lab of the Orem lab, and we were walking through it. And one thing you told me is, at Orem, our goal is to be the highest quality lab, to have amazing output. Um, and that's something that is in y'all's DNA. That's something as you continue to move forward and grow, that's a point that you want to really push and make sure people understand. And I think as we look at these search tools and the AI tools, it's how can we make sure that you can differentiate yourself that way? And so what are certain ways to do that? And I think that's going to be a very interesting kind of thing to learn. And I think it's I think when people know you and know y'all's products, and I was telling you a story earlier on this where I went to your website when I was talking with someone. The first response was, that's beautiful lab work, but how can you make sure that that gets into the algorithms? And if someone says, I'm looking for whatever it may be, I want it to be of the highest quality, and they know to go to your lab. Or if you say, hey, I'm doing this, I tend to I don't take care of my teeth. I'm just looking for the cheapest thing. It's temporary, whatever that may be. You know, that's not your ideal customer.
No,
So
right.
how can people make sure that that happens? I think is going to be a very interesting. Um,
Well, secretly, we're actually doing that for Orem right now because you've just said Orem beautiful dental lab work like 5 times. And so
right.
everyone's computer and their algorithms are now affected. Their phones are now infected. So thank you. That's a big assist. So I only joke, but let's face it, we all know the devices are listening all the time. So um, we'll, I've got another segment I want to rip through with you here, and
Okay.
that's called the Wisdom Bites. So um, quick answers off the top of your head. First thing that comes to your mind. Okay, one trend in dental technology and in patient engagement that we should be paying more attention to.
Yep. So I will exact to what we were just talking about. I'd say the rise of AI as a discovery lead gen channel for providers.
Okay, so and just to because I'm not going to let you off the hook that easy because
Yep.
with a repeat answer, tell me like what do you envision in terms of because a lot of people are paying attention to that.
Mhm.
Do you envision an area where you can go into where it's the standard now, the gold Orem standard, where you can open up Claude or Chat GPT and say, book me an appointment tomorrow or the first, the soonest appointment between these dates and this time with Dr. Rindler. And then it'll do it for you when it's done and sends you an email. Like, do you see that? Is that where it's going?
That is where I see it going. I see it going, I think, a few ways. I think yes. I think one, I think there's a pathway to that. So I think the first is you would go in and say, I have X insurance, I'm looking for a provider here. And I think it would then give you a link to that insurance plan. You open it up, and then the ability to schedule directly from there. I think a lot of that is because you're already logged in, you're able to send plan details. I think that works there. I think in the future, though, as it continues to build, yeah, I think that's very possible. But I think it requires a lot more data than is currently out there
Mhm.
for it to be trustworthy as far as booking those appointments. But I'd say that's at Intelibly, we talk a lot about our AI strategy of where we're moving forward. And I think kind of, even we're seeing from ultimately it's we want to increase access and ease for patients. And so if we have, a certain, we know all of the new patient appointments that are available over the next 2 weeks, and a patient goes to their insurance site and types in, hey, I'm looking for an appointment next Tuesday. I'm willing to go wherever in town. We can provide that appointment to them. Or, hey, I don't care when I get seen, but I don't want to go further than a mile away from my house. We can also find that for them there. And I think over time, the models will learn that, and that's how that'll ultimately move in that direction.
Patient centric.
Yep.
Love that answer. Okay. Next one. Common assumption about AI automation or practice growth that you believe is wrong.
I think it is wrong that AI will replace your job. I'm adamant on this. I think it will change what your job is. I think it will change how you do your job, and I think it will change the amount of time you spend on certain tasks. But I do not see the replacement of people, especially in the dental practice. I think that even as we talk, I was at a conference recently and saw a AI hygienist, a robotic arm, and that's awesome. And for some people, that's what they want. For me, that's not something I would ever want. I know that when I'm checking out of a dental office, I want to be greeted by a person. I want to check out with a person. There's
Mhm.
a personal touch. And for me as a consumer, that's very important to me. And so I think what we'll find is that AI will replace the need to do repetitive tasks. It'll replace the need to do mundane tasks. It'll replace the amount of time you're on hold waiting for things, but I don't think it will replace your job in the office.
When you said a hygienist, a robotic hygienist, there were so many GIFs and memes in my head going, nope, hard pass. Like that's not a chance.
And the
Like there's, I
technology
mean,
is awesome. I will say
yeah.
it's so cool. And I think there's so many solutions for it. And I think, like we mentioned earlier, people getting care. And I mean, there's a shortage of staffing right now. So I
Mhm.
think it's amazing. I will say
Yeah.
for everyone listening, but you
Yeah.
know, I don't think, and even all of those, when they talk about, they say it's still being overseen by a hygienist, but now they can do two patients at once instead of one. And so it doubles the output of the office. And so even at the end of that, it was like, we still have the need for people in there.
What I'm curious about that is, for me, I've got sensitive upper premolars. So if they're scaling away or whatever, or using GBT or whatever it may be, and they hit a sensitive spot with cold water, I'm gonna go like a little bit, right? The
Mhm.
hygienist knows, okay, cool it on that, or warmer water or more gentler touch, and they can adapt immediately. But
Yep.
how do I do that with a robot arm? Right? Like, is there a microphone that listens to me saying, like you're killing me here, right? So that I have so many questions for that, but we'll get back to that later. But you're right,
I have a
that
couple
human
engineers
touch.
I can bring in for the next talk.
Please, yeah, please, that would be so helpful.
Yeah.
And the last thing I'll say, I'm with you. I agree with your answer there. I'm not afraid to lose my job to AI. I'm afraid to lose my job to someone who knows how to use AI better than
Yeah.
me,
Yep,
right?
you nailed it.
That was a quote that I heard at the at a Strawman event back in October. So I can't take credit for that, but I like sharing it because I think a lot of people feel that sense as well too. Okay,
That's great.
next one. Share a lesson or an insight that's had a big impact on your career and your leadership journey. You're Mr. COO here. You're running a
Yeah.
company. Um, Tell me what has impacted you. What's one lesson or insight that you learned?
I think for that, I'd say it's early on in my career, I was told something that I feel has resonated throughout, and it's that there's not one way to lead a team, and that everybody on a team has a different way that they're driven, that you can get them to do, great output of work. And so understanding your team and how each person, what their drive is and what their reason why is for being on your team ultimately builds strong teams. It's something that I've been lucky from my first job to have. I think right now at Intelibly, we actually are one of our teammates, our chief revenue officer, Jason, actually, we had an all hands meeting. And the first thing he did is he brought up this worksheet and he said, there's three questions on this. And the goal is I want to understand how each of you operates. And he said, what's your best communication style? What
Mhm.
drives you? What time do you like to be reached? Do you like to be reached via Slack, via telephone, via email? And really understand each person. And to me, that's something that I really held on to, and it helped me where I was in college when I first heard that, everyone learns a different way, everyone's driven a different way, but that really helped me operationalize that into something that I know I'll take moving
Right.
forward.
Jason's a smart guy, and that's a great example because everyone learns differently. Everyone communicates and absorbs differently. That's something when I started working in the dental space, totally new mindset of people, of technicians. I asked all my technicians the exact same thing. What drives you? How do you like to be communicated to? I didn't ask them when because I didn't want to, I was trying to create boundaries and all that kind of stuff. But it's such a
Yeah.
great lesson. So kudos to you and Jason for implementing that culture at Intelligently for sure. Um, 3 to 5 years from now, next question. 3 to 5 years from now, what will differentiate the highest performing dental organizations?
Mm,
They're all going to use Intelligently was the answer. I had it right there
right.
for you. I'll give
Perfect.
you a
Yeah.
minute to.
Well, I ideally they're all using Intelliby in the next 1 to 2 years. So I'm thinking even in the future, 3 to 5.
Hmm.
I think in 3 to 5 years, it won't be who has the best tool. I think it'll be who has the most connected patient journey. And so who's thinking about that patient life cycle from a complete journey. And so, in software, they call it the development life cycle. But I think the patient life cycle that can be automated and really create the best experience for the patient from, inception of when the patient's looking for information about you to getting into your practice to receiving great care to knowing they can pay for it on the back end to leaving happy with either doing all their treatment or knowing, hey, here's a plan for treatment as I move forward. And then for the office having a simplified experience of claims processing of realized revenue, all of that. I think it'll be the entire journey. And so practices that can embrace going and doing the research, figuring out what works best for their practice, for their goals, for their teams, implementing that in a successful way and really tying that journey together will be really successful.
Yeah, I think you're right that it all comes back to what we talked about, 45 minutes ago was
Yeah.
what you said was change management, right? If you can't manage all of that change, you're you're in a cluster bomb of things that don't work, right? You're
Yeah.
jumping from one process to another that doesn't work. So I like that answer a lot. I got two curveball questions for you. I didn't give. Um, First one, we hear so much about in the dental industry, families working together. A solo practice, their brother-in-law is the accountant, or their wife is the office manager, or whatever it may be. You work day in, day out with your father. Give us a tip, a successful tip of working with family to make it work.
Yeah, no, it's great. I will say I think when we first talked about doing it, we were slightly nervous. I think the tip is being intentional. I think understanding, I mean, I would say separating work and life. My dad and I do not do that. We talk about work all the time. It's true, like we just do, but we're very intentional about boundaries on it. We're very intentional about respecting each other. It truly has been the best work experience I've ever had, and very rewarding. I think we also operate slightly differently. I think my dad, he jokes he's the mad scientist in the back room, coming up with the ideas and he built
Mhm.
out this vision of what Intelligently is. And then where I really operate is operationalizing, figuring out how can we get it done today. So I think our working styles and what we do works really nicely together. But I think one conversation we often have is being intentional about things, and often I'll say, "Hey, this is a conversation I'm having with you as my teammate, as my boss." To which he then jokingly says that I'm the boss. Depends on who you ask, but then or hey, this is a conversation not about work. I want to talk to you, as my dad. So, but yeah, it's being intentional is what I would say on that. I think we both know that ultimately what we're building at Intelligently isn't about us as individuals. It's about what we're building with our team. It's about what we're building for access to care. And so when you stay mission driven on that, I think that also helps.
I like that distinction so much. You could have taken that so many different places, so I'm glad you kept it safe for our listeners. I'm going to quote a book again that I've used in previous episodes because I think it's so relevant. It's Unreasonable Hospitality by Will Guidara.
Yeah.
Okay, I don't know if you've read it or not. It's a really good book, and he was the general manager owner of 11 Madison Park. And one of the things he said was, and I'm paraphrasing, I'll have to get it down again, is uh, perfection is not the objection. Perfection is not the goal. Doing things with intention is the objective. So everything that you do in the restaurant or in the practice or in your business, there's a reason for it, and it should be reasonably obvious to your end user why you've done it, right? And so for you, doing things with intention, that's such a great answer. Um, the last question, lighthearted, because you're an avid golfer. What's your favorite golf course?
That's a great question. I know why you asked this, and it's because it's in your backyard. My favorite golf experience I've had was at Kananaskis. I think it's an unbelievable place. Um, It's yeah, it's unbelievable. You look around, there's two beautiful courses, and everywhere you look is mountains. I think you can't beat that. I will say I do have a Pebble Beach trip coming up in about a year. So check back in next August with me on that one. But yeah, I love golf in the Canadian Rockies. It's addicting up there. So yeah.
It is. It's an incredible area. Pebble Beach is incredible for so many different reasons as well, too. So we'll have to have a very long discussion about which is better and why. Um, Love that. I really appreciate your time. For those of you watching and listening, I hope you found some guidance from this conversation. Um, Sign up with Intelligently. It's risk-free. It literally costs you nothing. You don't need to get your IT manager involved. Andrew and his team will take care of it. You can find them. It's www.intelibly.com. So it's INTELIBLY.com. You can also find them, Andrew and Intelligently, online on social media, LinkedIn, as well too. And my guest next week on the Orange Meridian, Dr. Susan McMahon, talking about innovation in modern cosmetic dentistry. She's built an incredible practice in Western Pennsylvania, one of the biggest. So join us for that one. But as we are here now, I want to say to you, Andrew, thank you so much for your time. I really appreciate it. You've got an incredible product, and everyone listening and watching, please check it out.
Thanks,
Thank you.
Robert. Always a pleasure to catch up.
Likewise. Thanks, everyone.
Thanks.
Bye bye.